Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to discuss something related with H3N2 virus. You might be aware that in the certain part of the world there are quite increased cases, incidence of H3N2 virus. What is this H3N2 virus? Whether it is a new virus, whether it is affecting only the children or it is affecting the adults also. What are the signs? What are the symptoms of this virus? Can we prevent it or can we get protection from it? What are the treatment modalities available for this type of the virus? What are the steps you can take to get rid of these viruses? And something related with the influenza vaccinations. So all those things today we will discuss in this video. I will try to explain almost all the things related to H3N2 virus, but it is a bigger topic because there are so many viruses which has this kind of the presentation. So it will not be sufficient to elaborate everything in a one video. So friends, let's start the video about the H3N2 virus. So what is H and what is N? So before going to the H and N, first let me tell you, if you might aware that there was a one pandemic about H1N1 virus somewhere in the 90s or maybe in the 2000. H1N1 the epidemic was there. I think it is 2004 or somewhere, or 2003 or somewhere. So H1N1 was the strain of the influenza, and popularly it was known as a swine flu virus. Why it was known as a swine flu virus? Because the reservoir, this virus stays into the pig means swine, so that's why it was known as a swine flu virus. So basically H and N are the spike proteins on the influenza viruses. So whenever you hear the H and N viruses, those are mainly influenza viruses. The influenza is commonly we know it as a flu or the common flu. H and N are the proteins on the surface of the influenza virus. So influenza virus is basically one small virus. So if you have seen the structure of the coronavirus, COVID-19, so it was like a small round virus and there are spikes. Those spikes are basically the proteins of the viruses. In the same way, the influenza is also like the small round virus and it has the spikes over his body. Those are the H and the N. Those are basically they are main proteins which causes the illnesses into the humankind. So that's why they are known as a H and N type of the influenza infections. So basically influenza viruses are of the multiple types. So if you have watched my video on the influenza infections, then you might be aware that there are four major subtypes like the A, B, C and D. A, B, C and D. So four major subtype of the viruses are there. Among them this H3N2 is basically type A. No need to go much in the detail about how the A and B and C and D are decided, but for parents it is important to know that there is something known as type A virus and type B virus. So whenever we do the test for the influenza, type A or type B might come positive. But type A is also multiple types, around 15 to 18 types of type A, and same type B are there. And type A is more severe or the stronger than the type B. So that's why this H3N2 is also the type A virus. So it is a bit stronger than the other influenza viruses. Now if we will look at the signs or the symptoms of the H3N2 or the influenza type A, so H3N2 is basically the type A virus. So all the symptoms of the type A viruses are present into this H3N2 also. So what are the symptoms? Basically the symptoms are again routinely like how it happens in the influenza infections. There will be the high grade fever, So on an average, influenza viruses tends to run the high grade temperature like around 39 to 40 degree temperature, so 103 to 104 temperature, and it runs over 3-4 days regularly, and many times it doesn't get come to a normal body temperature even after giving the multiple medications. So the viruses generate lot of immune response. So immune response means the body's fighting capacity. So whenever the virus enters the body start fighting very hard with the viruses. So in that process, this heat is getting generated. So that's why the fever is there. And to bring the fever in the body is also the body's defense mechanism, because whenever the temperature increases, these viruses cannot survive for a longer time. So that's why it is basically the body's defense mechanism to increase the body temperature so that they can kill the viruses. So that's why I always say that don't treat the fever aggressively. Fever is our friend. Fever is helping our body to recover from the infections. But yes, if the fever is there and if you have discomfort like you have the headache, body ache, tiredness, yes, at that time you can take the paracetamol to reduce that discomfort. So paracetamol, brufen you can use, but when you have the discomfort, not only just looking at the temperature. On an average, if temperature goes more than 100 degree or the 30 degree, you will start feeling the discomfort. Then you can take the paracetamol or the brufen. Okay. So the type A influenza always tends to run the high grade fever, 39-40 degree temperature. There are many associated symptoms. Which are the associated symptoms? Those are the more generalized symptoms, like the elder people or the adolescent children has the more of the headache. They never complain the headache, but when this kind of the symptoms are there, they start complaining the headache. There is the severe watering of the nose. Sometimes the eyes are watering, but it is like the tear kind of the watering, not like the eye discharge, not like the conjunctivitis. And they will start feeling the lot of throat pain and the intermittent coughing. Coughing is not significant in the most of the influenza in the initial days. Later on, the coughing will also start. So most of the features are of the H3N2 are not different than any other type of the influenza virus. Per se, you can say that it are more like of the COVID infection also, because on the COVID also the same thing, high grade fever, body ache, people will lose the sense of the smell, taste, like the myalgia, malaise, patient will not feel good. All those things are also the features of the influenza infection as well as the COVID infections. So it is very difficult to differentiate only by just checking that whether it is an influenza or the COVID infection or any other viruses, because most of the respiratory viral infections which is going through the nose and affect the respiratory symptoms all have almost similar type of the symptoms. Like you can name many viruses like the rhinoviruses are there, adenoviruses are there, influenza are there, parainfluenza are there, RSV are there. All these are basically the group of the viruses which affect the body's respiratory system. So all will have more or less same type of the symptoms. So that's why many times it is difficult to identify that which type of the virus is there in the body. So many times that's why the doctor advised to get you the test from the nasal swab, like the COVID swab from the nasal swab or the influenza from the nasal swab or the adeno swab. We will advise to find it out that which type of the virus is there. So you can understand how difficult is the doctor's job to identify, because almost all the viruses have a similar infection. Not only the viruses, even the most of the bacteria also has a similar type of the presentation. They also have the high grade fever, they also have the throat pain, running nose, cough. So in pediatric practice, we always want to first know that whether this is a viral infection or a bacterial infection, because viral infections are the self-limited infection. 4-5 days, 6 days, child will start getting better. But bacterial infections requires antibiotic. Once you will start the antibiotic, then and then child will start getting better. So all have the same symptoms. All like the tonsillar infection. Tonsil infections are generally bacterial infections. The bacterial infections requires antibiotic. Viral infection doesn't require antibiotic. So that's why all those infections has the similar presentations. So where the role of the doctor is important, he will check that which kind of the signs he is able to see, like whether he is able to see tonsils are bigger, he is able to see that there is a pus over the tonsils, whether he is able to see that ears are infected. Then he can decide whether you need the test for the influenza or not. or whether you require the antibiotic for that or not. So respiratory illnesses are the common chunk of the pediatric patient. Almost 70 to 80% of our pediatric OPDs are of the respiratory viral infections. So respiratory infections, they are viral infections, bacterial infections. We check and we tell that yeah, you require antibiotic, you don't require antibiotic. Many times I advise to wait for around 1 or 2 days. Then we will come to know whether it is a viral infection or a bacterial infection. So we went on the little bit far from the topic, but H3N2 all has a similar type of the signs and symptoms. Now how it spreads? It's basically spread through the respiratory route. So somebody is having the running nose, cough, or they are in the contact with the somebody who has already this viral infection, then it transfer. Now influenzas transfer from one person to another very fast. It is a very rapid transfer. And once the one person in the family is affected, it will start affecting the almost whole family. That's why the same thing happen in the schools and nursery, where there are a lot of children in a small environment. Like in one room there are 30-35 children, so they transfer from one child to the another child very fast, and sooner or later you will see in your mother's WhatsApp group messages that my child has a fever, he comes influenza positive, my child has a fever, he comes influenza positive. So those are the very rapidly transmitting viruses, and one by one the whole class, nursery class, start getting affected. So is there any way that you can protect your child from these H3N2 infections? So for all the respiratory virus infections, whether it is a COVID or whether it is an influenza or whether it is a para-influenza, protection mechanism is same. The mask is the important protection. So when the COVID was there, people has thought that this is a new viruses and we are getting protected from the COVID by wearing the mask. The same thing apply for all the respiratory viral infection, whether it is an influenza or a para-influenza or a COVID-19. So tight seal mask is important. Even if you don't have like the N95 mask, even routine 3-layered mask is sufficient to protect from the influenza infections. At least maybe you will get the partial protection, but you will get the protection. And again, the hand washing. Hand washing is important because in the nursery is the children's exchange their material, stationaries, paper, pen, pencil, they exchange. So that's why these children generally have the habit to clean the nose and throat, and then they will touch the stationery and then they will exchange it. So that is known as a fomite. So this kind of the fomite bone transfer is also common in the children. So frequent hand washing and the mask are the two important way to get protected from the H3N2 or even for the respiratory infection. Another important way to get the protection is the vaccination. So influenza vaccination. So the influenza vaccine which is available now contains 2 strain of the type A influenza virus and 2 strain of the type B influenza virus. So there are basically the 4 strain of the influenza virus. You can get protection by taking the influenza vaccine. I have already made one separate video on the influenza vaccine. You can check that video. That will be helpful to when to take, how to take, how many doses of the influenza vaccines are there. All those informations are available on that video. Roughly, I will tell you it is like the 2-dose vaccinations if the child is 8 years old and if he is taking first time. Once you have taken first time the 2 doses, then every year it is a single dose. And generally we advise to take the flu vaccine before the flu season starts. So it depends on the country to country. In some country the flu season start in December. In some countries flu season start in September. So based on your country where you are living, you have to find out when is the flu season and you can take the flu vaccine prior the season starts. So less than 8-year child, if he is taking first time vaccine, it is a 2-dose vaccine. After taking the 2 dose, it is a single, and if your child is more than 8 years, then only the single dose. Every year you can take a single dose. It is not a compulsory vaccine, it is a optional vaccine, but it has seen many times that if you take the vaccine, children's respiratory infection rate goes down drastically, because many times with the vaccine, with the influenza vaccine, maybe children are getting protected from the other type of the influenza infections. So that's why their infection rate, respiratory infection rate goes down drastically. So this is about the influenza H3N2 type A virus. It's a respiratory virus. The common signs and symptoms are the same: running nose, cough, high grade fever, smaller children reduced feeding, they are more irritable. All those things can be there. Protection is easy by wearing the mask, by taking the vaccine, frequent hand washing. Now suppose you, even in spite of doing all those things, you got the H3N2 infection, then what you can do? Even after taking all the precautions, you are not going out, you are wearing the mask also, you are doing the frequent hand washing, still there are chances because it will transfer to the air. So if you get the H3N2 infection, many times it is because it is a type A viruses. If the people are in the high risk categories, like those who has asthma, cardiac disease, or some or other medication if they are taking, then we advise the medication Tamiflu. Tamiflu medication we advise. If the children like the less than 5 years, definitely we advise to take the Tamiflu if they are in the high risk situation. So, or Tamiflu is basically the brand name. The generic name of this medication is oseltamivir. So oseltamivir, you can there's a 2 doses of the oseltamivir, like the twice a day. 2 doses means twice a day you have to take for the 5 days. So total 10 capsules of the Tamiflu. Doses vary as per the age and age of the child. So sometimes we ask them to dilute and take the medication. But whenever you take the oseltamivir or Tamiflu, if you have to use the lesser dosage, then you have to dilute in the water, and that medication you have to put into some juice or maybe some honey and take, but don't take it directly, otherwise it will cause the vomiting or the severe abdominal pain. Adults can take the capsule directly, that is not a problem. Other medications are mainly the symptomatic medications, like the medicine to reduce the fever. If there is a nasal block, you can use a nasal spray. If you have a lot of running nose, then you can take the antihistaminics. But the most important thing, which is non-pharmacy, basically without medications, is the rest. Do the proper rest. Rest is very important. Whenever the respiratory viral infections are there, you have to take the proper sleep. You have to drink lot of amount of the water, drink more water, hydrate well. So 85 to 90% of the patient who acquired H3N2 infection doesn't require any medications, just a symptomatic medication like the paracetamol or the brufen, antihistaminic, and the rest and the hydration. Once they will start taking the medication well, once they will start taking the rest and the hydration well, on an average 3rd or 4th day, they will start getting better. But suppose if the condition worsens, like the faster breathing starts or the fever is persistent, too much myalgia is there, child cannot wake up, child cannot feed, definitely you have to take to the hospital. He might require hospitalization, he might require IV medication, those kind of the things can be there. So friends, no need to get scared with the names like the H1N1, H3N2, adenovirus. All those are the common viral infections which children is getting affected. This is not a new virus. These are the viruses are there since ages, maybe before our birth. So no need to get worried with just the name. Only issues with this type of the viruses are they change their shape, they change their color, they change their intensity every year, and that's why we have to take the influenza vaccine every year. So I hope most of the things I have covered. What is H3N2, what are the signs, symptoms, how you can get protection from it, how and when you can take the vaccine about it, and once you are getting infected, what are the things you have to observe. So if you find this information is useful, then you can share with your friends, family friends, colleague, and let them know what is this H3N2, and don't get panic. The common routine influenza infections, and I wish best of health to all of you. Thank you very much.